top floor of the WSGC Studio Tower building. And now we welcome, man, the whole room. If I get any names wrong, Andy, Brooke, Rachel, Tanya, and John T. What?
Good to be here, Sam.
Tyler Taylor, ladies and gentlemen. And look, what an awesome time for y'all to come in and just to get to talk about Elbert Memorial Hospital and the offerings that we have right here in our community. And we just want to start off right now and talk about the ortho and therapy that you get right here at Elbert Memorial Hospital. So let's go to Brooke and Andy. Andy, let's start with you.
Yes, so Dr. Ryan is an orthopedic surgeon that comes to Elberton weekly to see orthopedic patients here in town at the clinic right across from the hospital. We do monthly procedures here with him at the hospital. We do a variety of orthopedic procedures, shoulder, knee scopes to improve mobility, decrease pain, arthritis issues. He does rotator and labral tears in the shoulder, meniscus tears in knees. He also does wrist and elbow procedures for numbness and tingling like carpal and cubital tunnel. And then he, for over a year now, he has been doing total joint replacements here at the hospital in Elberton. So he is doing knee and hip replacements. You can go to the office here in town. You will see him and have your pre-op done with us right across the road at the hospital. The patients go through a screening process. We review everything to make sure they're safe and a good candidate before they're put to sleep. And then you come in with us on your scheduled day and you get your new knee or hip. And the goal is for those patients to go home same day. So we've had great success rates with that, with patients coming in, having that done, and going home.
And we've had multiple patients too, Andy, come and get both knees done at our facility, right? Like they'll
Yes.
come 1 month and get one knee done, especially a lot of patients locally, and then come back and get the other knee done.
It's just convenient for like coming to town. Like I said, the clinic's right across the road from the hospital. They schedule their pre-op. They just walk over to us, get their pre-op done, and then they come for their scheduled procedure and post-op visits and therapy and all. Once you have that total joint like that, it's easier not having to drive 45 minutes up the road. So he sees them here post-op again in town. And then before they're discharged home, he even has them in therapy, rehabbing. You're walking, you're going up steps with our rehab team in the hospital before you're discharged home that day, the same day. So that way the patient's confident and comfortable to go home with that new hip or knee.
I know. Can you believe that, Stan? You
No,
walked the
yeah,
same
I
day
was
after
just
a total
thinking,
joint replacement?
Yeah, I mean, that is amazing.
It is amazing. And so that's where Brooke and her team come in. Brooke, she sees our patients after all those total surgeries, and she forms a relationship with them, and her and her team work great with our OR team as well.
Y'all are superheroes. I mean, really. And so you can have a full hip replacement right here at Elbert Memorial Hospital?
Yes.
Small but mighty, Stan. We're small but mighty.
I'm telling you what.
The procedure is like about a 45-minute procedure, and they go to recovery, and then Brooke gets them and hopefully gets them moving, getting them on out the door.
Yes, we have loved Andy's team starting to do same-day surgeries here because it's probably been about 2 years now steadily where it's once a month on a Wednesday. Always, I come as soon as the patients are stable after surgery, assess their mobility, teach them how to position their legs when they get home, and then most importantly, show them how to use their walker, get them walking, and then it's specific to what the patient needs to do to get home. If they have stairs, we'll go ahead and do the stairs. If they have unstable ramp, or anything unlevel, anything that would challenge them to get home, we go ahead and do. So some of them go home pretty quickly after surgery if they're real eager. Others might need a little bit more confidence boost, so we'll see them 2 or 3 times that same day just to make sure they're confident to go. And then Dr. Ryan likes them to start outpatient therapy 2 days later, so then they come back to me that Friday morning. They already know me. They're already comfortable with me. I saw them in their vulnerable states right after surgery.
Yes.
And so we just get right started. It goes well. I see them 2 times a week for about 6 weeks, work on their strength, mobility, balance, all of those things.
And get them back into action, back into...
and total joints to someone who's not clinical, it's not as scary as it used to be. It's something that's really...
It's amazing how far it's come along.
Yes.
Wow. I just feel like this is amazing. And folks, this is right here at home, Elbert Memorial Hospital. I love what Rachel said, small but mighty. But I'm telling you, we are becoming a tri-county like hospital.
Yeah.
I mean, we are really having a place where our neighboring communities can come and have, like, not only be treated but have the post-op as well.
Exactly.
you
And
know.
Brooke and her team do a lot more than just post-op recovery for ortho.
Yes, we have occupational therapy, we have speech therapy and physical therapy all full time. We spend 1 hour one-on-one time with our patients. We see patients of all ages, as young as infant age all the way up to
Oh, wow.
near 100. If you can tolerate therapy, they're coming. But we have a great team. We've got some new equipment. We have cardio and pulmonary rehab who have joined us. And so we have a lot more cardiac equipment as well for endurance training. We utilize the Wellness Center as well for additional strength training. But we're a good team. We all work really well together to give the best care to the patients. And we're making really great progress in the community.
And a lot of these therapists saying if you come to our swing bed program, you form a relationship with them because a lot of Brooks therapists see them in the swing bed program and then they can transition to outpatient as well.
Wow.
But I think one of the biggest things to note is that we are working on seeing pediatric patients. A lot of those pediatric patients, sometimes their insurance like them to go to a freestanding facility, but we will try our best to get their visits approved and do insurance verification. If you be a little patient with us, we have to, we're learning those that let us treat those pediatric patients at the hospital versus those freestanding clinics. So we're right here in a lot of the children's backyard, so to say. So them not having to travel and the parents not having to travel to get pediatric
That's
treatment
huge.
helps
That's
a lot
big.
too. Yeah.
Yeah.
And I know for being a mom having kids, it's so easy to get access to get into our facility.
Yes.
You walk in, you turn right, and there
You're
we are.
there. You're right there.
Versus parking in a parking
true.
garage, walking,
Having to walk
driving.
over,
So
take the
it's-
elevator,
yes,
get on the
and-
wrong floor.
And even for patients that, are having issues, you're right there when you walk in the door.
Yes, and even like older patients with balance issues, just knowing that we're close, we're nearby, we can walk them to their car and back. You're
Yeah.
not walking 10 minutes to get to where you need to go.
Right. This is amazing. And folks, Elbert Memorial Hospital, it's right here at home. And whether you're in Royston, Hartwell, I should say Franklin County, Hart County, Wilkes County, Oglethorpe, Madison, Elbert Memorial is here for you. And this is just incredible. Brooke and Andy, y'all are heroes. Y'all are doing some incredible things. So look, they're even wearing capes
I know,
today.
that's what I said. I have their capes. I have their capes just for them to wear tomorrow.
It, I've never seen green scrubs before until today.
Well,
Today.
EMH, we bring out all the big
I'll
things.
say,
Is it
that-
green-
That's
is
me
it-
sporting the green.
Is it Green Scrubs Day?
No.
Is it because I also see Tanya Chitwood, or as I call her, Reba McIntyre, and so yes, Tanya is y'all's singer at the hospital. So
Absolutely.
but I just want to say you're wearing green too, like you had the green. So
I
did
am.
y'all, did y'all call each other?
Yes. It's
It's-
fall.
Oh, it's fall.
Wait,
Oh, so-
Tyler is too.
Well, let's see what Tyler Taylor's wearing.
Yeah.
He's got a little green in there.
We coordinated today.
That's right. And
Stan, why are you not wearing green?
I could be, but I can't tell you. No, I'm just kidding. Well, is it it's St. Patrick's Day all of a sudden? No, it's fall. Yeah, yes. Well, look, like the hospital, how lucky are we, and Tyler, to have the offerings that we have and what we've accomplished, and the new, just the investment in new equipment in our hospital over the last couple of years has been incredible. So, and it's just a really neat experience.
Stan, you're right. We're very fortunate to be able to provide the services that we provide to our community. We have a wonderful staff, as you can hear, and your audience can hear. We're so fortunate. Since 2010, 132 hospitals across this country have closed. Small rural hospitals just like us, 10 in the state of Georgia alone. So we're very fortunate. The system itself, the healthcare system, the way it's set up, it's very, very difficult to provide the care that we're providing to a small community. The system is set up for volume, and from a population standpoint, we just don't have that volume. It makes it really, really difficult and challenging with the age of our facility, with the skill level of people that we're able to hire and provide this care. There are many, many challenges, but we are rising to those challenges, and we're very committed to that. So we're providing this care, high quality care, close to home.
I love it. I love high quality care close to home. I love that. That is so awesome. And of course, rural hospitals, we know of some that have closed. In ours, I just love the investment that has happened in the new services, the new technology that is available, and it is so awesome. And so it's just really incredible. And there's a lot of new. We speak of technology, but there's also a lot of new things like telehealth and things like that. And now we bring in like what I call chief nurse. What's
Yes.
your position? Chief
Chief
nurse.
nursing
Yeah,
officer,
chief
yes.
nursing officer. I got it right.
The
The queen, ladies and gentlemen, the queen, Tanya Chitwood. But telemedicine is something fairly new, but now more people are finding out about it, and that is now a part of healthcare too, right here at home.
Absolutely, and that's another thing that makes us small but mighty. We have specialty services now that we can offer our residents here in Elbert County and surrounding through Equum Telehealth. So what we do with Equum is it is actually a computer. We bring it into the room. You are actually looking at a specialist face to face. They are talking to you. You are talking to them. You have questions. They'll answer your questions. They're really informative about what's going on. And at Elbert Memorial through Equum, we're able to offer intensivists, which are higher level physicians that if there's something more going on with you that you need a higher level of care, if we can offer that at Elbert Memorial, that will actually keep you from being transferred to a larger facility.
Oh wow!
Yes,
Yes.
they partner with our physicians at the medical center that see patients and also our hospitalists inside the hospital, and they are actually consulting, and they will come, and if the patient gets admitted at Elbert Memorial, we will make rounds on them once, if not twice daily with that specialty service as well. We also offer nephrology, which is anybody that's got kidney issues or kidney problems. In the past, if you had anything going on with your kidneys, or if you were, say, a dialysis patient, we would have to transfer you to a higher level of care. We still don't offer dialysis within Elbert Memorial, but if you've been dialyzed and just need some kind of specialty treatment from a nephrologist, we can offer that through Equum.
Wow, that opens so many doors and making this a true like mighty hospital.
It does.
Because things that you would have to go to a bigger like area for, and that is incredible.
It does.
So,
And then we also do pulmonology. They offer that services. So anybody that's got breathing problems, COPD, congestive heart failure, high levels of pneumonia where they may need some specialty treatment or services, we can consult them. And then also the big one in this area is cardiology. We're able to offer a cardiologist to actually see a patient face to face. One of the big things in our community that we noticed that was being shipped out a lot to other facilities that didn't necessarily have to do that is those patients that are having what they call an NSTEMI, which is it's a heart attack, but it's
Yeah.
a type of heart attack that's not doing extreme heart damage.
yeah.
And unless that patient has to have a cardiac catheterization, they could actually stay at Elbert Memorial, and we can treat them with the same treatment medication protocols
Wow.
that they would do at bigger facilities.
Wow, that is incredible.
It's huge.
That is incredible. And when did this take effect with
We
Equum?
started this in end of April, beginning of May
Beginning
of
of May.
this year. Yes.
So fairly new, but now many more ways that Elbert Memorial Hospital can treat our patients in our area, and really cool information. The fir- The first.
That's
Mhm.
right.
Yeah, we're Equum's
first.
first.
It so that is incredible, y'all. I mean, we're really bringing technology right to the people through our local hospital, and that is incredible. And then the kids too, like kids.
Absolutely. We
Yes.
love our itty bitties here in the community. We do not have a pediatrician in our community, so one of the things we have done is partnered with CHOA and Mercer University to offer the kids ABC program. And what that entails is that we can actually get our hands on a pediatrician or a specialty pediatrician that we need for any kid presenting to our emergency department. If our ER physicians are not comfortable treating them or maybe need a little bit more information on best practice, we can call the chirp line with CHOA, and immediately we get in contact with a pediatrician that can help us offer those services.
Wow, incredible. So serving kids of all ages, from 0 to over 100.
Absolutely. One thing
Yes.
I wanted to add, because you were talking about the equipment that was purchased for the hospital within the last couple of years, Kids ABC, through a grant with them, also has invested over $25,000 of new equipment and supplies to our ER,
Yes.
and so that we can specially treat pediatric children.
That is incredible. Wow. It just continues to be a blessing right here through Elbert Memorial Hospital, and so cool.
It
So cool.
does, and we have we're also sending all of our nurses for training out to CHOA, so they actually spend a day out at CHOA getting some training on pediatric specialty treatment. Abby Noggle, who is here local to Elberton, and also Allison Eccles, who lives in Wilkes County. They were two of our first nurses from the ER to go and said it was a tremendous experience. So before all of it's over, we'll have them all gone to CHOA and getting some training.
That's so cool, because then they have the hands-on experience
They do.
and know even more ahead of time how to help folks, and that is so cool. Tyler Taylor, setting up Elbert Memorial Hospital to be the best hospital in Georgia, as far as I'm concerned.
We hope so. We hope
Yes.
so. Thank you, Stan.
That is right. Well, look, I want to thank everyone for being here, because I know y'all schedules are so busy. But folks, to have this important information brought to you and understanding and learning more about our local hospital, please visit emhcare.net, emhcare.net. Just spell that out and check out online to see what your hospital can do for you. It is amazing what we are doing at this time in using the technology and growing with the community. So incredible. And I want to give a special thanks to Brooke, Andy, Rachel, Tanya, and Tyler today for coming out and doing this community spotlight. We are so
Thank you,
blessed.
Stan.
We are so
Thank you.
thank y'all. We're so blessed to have heroes every day that we're surrounded by our local hospital. Anything else, Rachel, before we wrap up? Yes. Okay. All right. Look, free face painting this Saturday at the Fall Festival. Don't miss out on that, and some other goodies. Always some cool swag that the hospital has. Look, Rachel's got some cool stuff. What you got cool now? Oh,
Face paint.
a high five, y'all. That's cool. You know what's cool? It's a high five.
Hey, we can sing for you. We'll sing to you.
yes,
Come on out. We'll
yes,
sing
yes.
to you. Yes.
Look, I enjoyed Tanya as we go off. Not only do they serve the community, they join the community as well. And Tanya Chitwood actually was on our Voice of the Fair contest this year, and as she was last year. And this year, how far did you go last year?
Last year I was third. This year
Third.
I was second.
Second.
Yeah.
I feel something coming next year. But I want to say how awesome it was to see her. And talking about the hospital family, I noticed that Al McCall not only cooked for First Methodist Church Sunday, but he played at Bethlehem Global Methodist Church Sunday. And so that is Rachel's husband. I want to say her better half, but she's his better half. You know what I'm saying? Too. Yeah. He's like, Lord, I'm going to make this right.
I'm here.
But I just want to say how awesome it is, and everybody has this. I mean, I know Andy's big with the foundation and doing things, and Tyler's at every meeting I see. I mean, but to be so interwound, and Brooke, I know you do a bunch of stuff too. So I'm not. Yeah, I just don't know Brooke well enough to. But
just comes from Hartwell, so we're glad that she just comes across.
hey,
the line.
thank you. Y'all have the best restaurants. So I love the restaurants in Hartwell.
Come eat.
I will. Trust me. This boy ain't big for no reason. And, but it's just so awesome to see our community not only being serving at the hospital, but serving in the community as a whole group. So thank y'all so much. I know your schedules are busy, but thank you for this time.
Thank
Thank
you.
you. Thank you, Stan. Thank you
Thank
for all
you.
the support.
Visit Elbert Memorial Hospital at emhcare.net. Y'all stay tuned. We've got more coming up your way. We've got a little bit of Merle Haggard on the way, Josh Turner. But right now, here is Eric Church on 105.3 WSGC.